It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join Paul David and Kyle Benedict as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives in Yavapai County. And now here's today's Countywide.
Welcome to Countywide. I'm Kyle Benedict. Today, the topic of discussion is prescription drug abuse, just drug abuse in general here in Yavapai County, the state, and we'll also just talk about the nation. This is a national issue. And here to talk about this and give us the details is two health educators from Yavapai County Community Health Services. We have Kristen Robertson and Stephen Elston. Thank you both for being here today.
Good morning. Thank you.
Thank you.
So just chatting with you a little bit, this is a huge problem, and I think a lot of people hear about it, and we hear about it nationally. We hear bits and pieces here and there on local news about stuff that's happening here in the county. But when we're talking about prescription drugs in general, let's kind of maybe just start there. Kristen, with prescription drug, can you talk about the problem that we're having here?
Sure, and it is on the news, national and local,
Right.
Every single day I hear about it. It's considered an epidemic.
Man.
And so for some numbers, 19 million Americans are using prescription drugs right now. That's 45% of Americans are on some type of prescription drugs or controlled substance. And nearly 2 million are considered addicted to prescription drugs, including opioids. And what we're concentrating today is opioids,
Okay.
mostly. But so that those deaths equate to, there have been about 165,000 deaths from 1999 to 2014, and currently the death rate is about 78 people a day are dying from prescription drug overdose, which is one every 19 minutes or 3 per hour.
Wow.
And so it's a growing, increasing trend, and it's not going down. The numbers are going up.
And you know, it's a difficult subject because when you're talking about prescription drugs specifically, I mean, there's a lot of people out there that need these,
There
that
are.
require them. So who's abusing these drugs?
So there are a lot of legitimate reasons for prescription drug use, and there are a lot of good reasons that doctors prescribe them. You know, after serious surgery, for terminal patients, for cancer patients, major back pain. So the idea is not to do away with them, but to decrease availability to people that might abuse them. So we're not talking about the people that need them.
Now, Stephen, when we're talking about as a health educator, what is, I mean, educating the public is of course a big role of what you do. Can you talk about the message that you're trying to get out there for the community? I mean, I think as Kristen touched on, a lot of people are aware that this is a problem, not just locally but nationally. But what is that message specifically that you're trying to push out there to the community?
Well, it's important when sharing this with the public to understand kind of the history behind opioids, and America itself has a pretty interesting history. Opioids and using it to, heal pain has gone back thousands of years. But in America, doctors started noticing issues right around the 1920s with issues of addiction, abuse, misuse, and mistreatment of opioid drugs. And so there's been kind of a stigma to, hey, look, this is causing lots of issues. And so there's been a big decrease since the 20s. And then it wasn't until about the 80s or 90s when, drugs like OxyContin, Percocet, Vicodin came into play. There's a lot of money in prescription drugs. There's a lot of testing done before these drugs came to market. And because of that, there was a lot of statements saying that it's totally safe. Let's get, opioids back on the market. Let's help people, treat people. And a lot of people were treated with opioids. And then lo and behold, 10, 15 years later, we see a lot of addiction again. And so it just goes to show that, prescription drugs, it's a big issue. It's a big deal. And we're dealing kind of with the amount of prescribing that has been going on since the 80s and 90s. And so luckily for us, and the CDC kind of caught fire to this and distributed different grants out to different states. Yavapai County, amongst a few other counties in Arizona, picked up this grant, and we're dealing with issues of decreasing prescribing. So doctors talking with them, showing them warning signs of what an addict may look like, and sharing that information with pharmacies, some of the community members, and really trying to decrease the amount of prescribing that's happening.
So just education and all, I mean, we're talking about the public, but then doctors as well.
Right.
And so it's almost more of, because it seems so easy. Somebody comes in with an issue or pain, and, this is something we could give them to combat that pain or whatever side effect or symptom that they're having. So it's good to hear that everybody involved in this is being educated. Maybe going back a little bit and talking about opioids, Kristen, what exactly are opioids? Can you kind of break down that word for us?
Sure. Stephen mentioned a few of the brand names such as Percocet, hydrocodone, oxycodone, or OxyContin. So an opioid is a very strong analgesic pain reliever. And the illicit version of an opioid, which basically has the same chemical makeup, is heroin. So they're pain relievers. And but some of the harm they can cause is a decreased heart rate and decreased shallow respiratory rate, which is where death comes in. I forgot to mention too that a lot of the problem is from combining two or more widely prescribed classes of drugs. So an opioid is one class of drug, and then what's commonly used by people on opioids might be an anti-anxiety, such as alprazolam or forgot the better name for, or the more common name for, it's Xanax.
Oh, okay.
Actually,
Xanax.
Everyone knows
that's
that
a
name.
very common
So
one. Yeah.
So
They hear about.
somebody who's on an opioid for pain and then Xanax for anxiety or for whatever reason, if they're on those two, they have a four times greater chance of passing away from overdose.
Wow.
Right, and so the problem
Wow.
is when two different doctors prescribe, or if they go to two different pharmacies and they don't catch it. So, and you were going to talk about the database eventually, but
thanks for
Yeah.
segueing to that. Part of education is, our intent is to ultimately decrease the number of prescription drug overdose. So sharing information like, if you happen to be taking any sort of opioid, even heroin, don't mix that with any sort of benzodiazepines, because it's going to, suppress your heart rate, suppress your breathing, and could eventually cause overdose. But also, with monitoring patients, who has what, who's getting what. There are different databases that are coming out. Some states are already on board. Arizona, in about a year, should get all prescribers on board to what's called the Controlled Substance Prescription Monitoring Program, or sometimes you might hear it as Prescription Drug Monitoring Program. But part of what Chris and I are doing is actually trying to get doctors on board early so we can attack it as early as possible, so we can track who's taking what and make sure that everyone's safer, and that understanding outlier doctors that may be over-prescribing, and to get them, it's not necessarily good or bad. Sometimes they're not aware of how much they're prescribing compared to other physicians and doctors in the area.
So try and prevent somebody who gets prescribed medication and then 3 days later, they're at another doctor trying to, hey, I need this, I need my prescription.
That was
filled
the
again.
trend, and people were actually spending all their time driving cross country and visiting doctor office and pharmacy after pharmacy. And the CS, I'm going to try this,
Lots of
the
acronyms.
CSPDMP comes from the Board of Pharmacy, and it's managed by them. And what else was I going to say about that?
That seems like a very difficult task. I mean, when you have somebody going from doctor to doctor, different city to different town, county to county, it seems like it's very tough.
And this should catch that the same way when people were getting Sudafed when it had the active ingredient and the decongestant that was used in meth. It's kind of the same thing, so just a different database.
We got to take our first break. When we come back, we'll talk about just some of the education that's going on over there at Yavapai County Community Health Services. Good website for more information on this or just anything health related, yavapaihealth.com. Phone number 928-634-6872. This is Countywide. Back in a couple minutes.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
Can we get strawberries? Okay.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Welcome back to Countywide. I'm Kyle Benedict. We're sitting down with health educators, two of them from Yavapai County Community Health Services, Kristen Robertson and Stephen Elston. And we are talking about prescription drug abuse. We're covering opioids and just drug abuse in general, and how it's such a big problem locally here in the county, the state, nationally. We're hearing more and more about it. And it's good because the conversation that you're hearing from national outlets seems to be more about just the message getting out there about this being an issue and trying to figure out how to combat this. And so we're talking about locally how we're doing just that. But when we're talking about, Kristen, prescription drug abuse and the people who are abusing these, what age group, what type of people are we talking about here? I mean, we've touched on how important, and it's a difficult topic because so many people need these medications, but
Correct.
who are the people abusing them?
Yeah, the people at greatest risk right now are non-Hispanic whites, first males, and closely followed by a rapid rise in the number of middle-aged white females. The ages would be approximately 25 to 54 are the numbers that we have right now.
Okay.
And,
Wow, and it just seems, I mean...
The females increased by 400%
Really?
between 1999 and 2014.
So when does health services get involved with this? When are you guys, I guess, are you contacted when there's a situation, or are you just given
Not
numbers?
necessarily. We do go to talks and trainings with law enforcement, so we are aware that way. We don't necessarily get called for help except for through our grant. So we're lucky to work on this grant and be able to tackle our strategies on this.
And kind of going back to the I guess just national stage that this topic is on. I noticed on the internet, and you sent us a photo of it actually, of a couple parents in the car,
Yes.
completely passed out with their seatbelts on, and you have the child in the back seat. And this is something, I think, a very powerful image for those watching on Verde Valley TV. You can see the images there. But for our radio listeners, you have mother and father, it appears, completely passed out in the front seat with their seatbelts on, and the child alert and awake in the back seat.
So what happened there, and what brings this close to home is this town, it's a small town in Ohio that's about 11,000 people. And the police department, what happened is an off-duty officer was behind this vehicle in a school bus. When the school bus took off, this car didn't move, so the officer got out of his vehicle to check on him, and the car was in drive and running. So he put the vehicle in park and turned the ignition off and proceeded there with probably administering Narcan, I believe, to bring them conscious. And the child in the back is a 4-year-old. And a pretty controversial decision to post that on Facebook, but the police department was feeling so overwhelmed and so understaffed to deal with the amount of overdoses that they've been handling that they decided, you know what, this is worth publicizing and bring some attention to this.
Yeah, sometimes you have to provide that shock factor for people in order to have it sink in almost.
Right.
And this, I mean, the fact that they're in their vehicle, it was on, they got their seatbelts on, it just, I mean,
It'd take
must have happened
nothing
just like that.
for that foot to come off the accelerator.
Yeah, it's very. Now, do we know what kind of drug was a result of this?
Yeah, the results aren't back, but they did find a white or a yellow. Excuse me, I got the color wrong. A pink powdery substance under her, which indicates that it's likely to be a very strong animal tranquilizer called carfentanil. Fentanyl is another thing that is used. It's another medication used for people for pain. I've seen people with fentanyl patches on. Carfentanil. So fentanyl is about 80 to 100 times stronger than, let's say, a regular synthetic opioid such as hydrocodone.
An animal tranquilizer. Now, is that an issue? People with abusing medications for their animals?
Yes, we do visit veterinarian clinics, and we have heard back from the staff at those offices that people quite commonly come in and request opioids or anti-anxiety pills for their pets, and the doctor knows that the pet doesn't really need that. So,
and we have a special, kind of a program for veterinarians that we go speak with, give them literature to hand out to their patients as well, to kind of spread the word that it's not just your opioids for back pain or what. So people abuse all types of drugs, including their animals' drugs.
So now, family members who might think that they have a friend or a member of their family who might be abusing drugs, whatever it may be, what are some things that they should be looking for? How do you handle that as a family member or just a friend?
Stephen, I think, it really affects everyone. A lot of times we used to think that drug abuse, especially with opiates or heroin, was like an inner city issue. It's an issue of certain minorities or whatnot, but now it's affecting everyone. So it is important to understand warning signs. There's different warning signs with people who are shopping for drugs, like we mentioned before. But warning signs, if you have a family member, it could be the pupils are pinpoints, very dilated, droopy eyelids, abnormal functioning, tremors, sweating, evasive answers too. I'm sure there's a lot of parents who are worried about their children, abusing drugs. And so, first thing is, understanding warning signs and being compassionate and caring for the future.
Yeah, and just when you're talking about kids, just talking with them, I imagine too, and just being open with them and being proactive, because you got to think it's everywhere. I mean, you turn on the news and you're hearing about this, or local, national, you're reading the paper, whatever it may be. This issue is everywhere. So we're going to take our second break. When we come back from break, we'll talk about some of the partnerships here locally that Health Services has and what they're doing, again, to just kind of get this message out there and make sure that we kind of stop this problem where it's at. So again, YavapaiHealth.com is a great resource online, YavapaiHealth.com. This is Countywide. When we come back, continue our discussion on prescription drugs.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
get strawberries? Okay.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Welcome back to Countywide. Just a few minutes left here in the program. We're sitting down with Kristen Robertson and Stephen Elston, health educators with Yavapai County Community Health Services. Stephen, what are some of the changes that we'll be seeing here within the state and the county to kind of combat this issue?
Well, statistically, with our data, we've noticed that the amount of deaths has surpassed vehicular accidents as the #1 cause of death in Arizona.
Wow.
For injury
Wow.
death.
Pretty shocking.
And very shocking. Because of that, Arizona's taken some lead with different legislation. One important part of legislation is allowing naloxone, which is an opioid antagonist, completely harmless unless you have opioids in your system, to be prescribed by doctors to any sort of lay people, especially law enforcement that may be dealing with even synthetic drugs like fentanyl that's airborne, very lightweight, very dangerous, for people to have it on hand in the case that someone, they know in front of them, or, friend, family, doesn't matter. Anyone who may be at risk can have these naloxone on hand, and it's getting easier to use. It can be intramuscular into the body or even intranasal. It really saves lives, and right now it's at a decent cost. It may rise, in the years come, but I think that's a huge jump for Arizona, and I think everyone should be aware of it.
Right, yeah.
I was going to mention just a couple of famous names of opioid overdoses, which lately was Prince, but surprisingly, Elvis died of opioid mixture overdose, and so did John Belushi.
Oh, wow. Yeah, I mean, that just right there shows you this is not a new issue. It's just continued to unfortunately be a problem here. But that's all the time we have today. I also want to mention that Health Services is working with some local organizations as well, including MatForce, to just kind of help combat this problem. And they have working with drug disposal programs and all that stuff, just trying to give the community ways to try and get control of this. So I want to thank you both for being here today. And
Thank you very much.
Yeah, thank you guys for continuing to get the word out there and educating the public on that. So that's all the time we got for Countywide today. We'll see you next time and talk to you next time again. This is Countywide. Have a good one.